Hi, I'm Kirsten.
And I'm Kelsey.
And we are estheticians and CoolSculpting specialists here at Renaissance Plastic Surgery in our medical spa. And we would like to welcome you to our virtual Cool event. Be sure to stick around till the end of the event for a live Q&A. You can submit your questions via the questions tab, where Kelsey and I will be there to answer them live. And what you've all been waiting for is what our giveaway is for tonight, and that is a transformation package. You will receive one entry for coming in for a consult and another entry if you buy a package at your consultation. There is no purchase necessary to enter, and you must be a candidate to win. And our special is, with any purchase of a transformation package, you will receive 10 free CoolTone treatments, as well as a free Fermentone by Skin Medica.
So CoolSculpting is the #1 non-surgical body contouring device out on the market, and it uses a unique technology called cryolipolysis. Cryo meaning cold or freezing, and then lipolysis is the killing of the fat cells. So it basically freezes the fat cells during the treatment, and then about 2 to 3 days later, the fat cells will start dying off one by one, and they'll continue to do so over the course of the next 3 to 3.5 months. And then your body just naturally will process them out through your lymphatic system. CoolSculpting's been around for over 10 years now, and I've personally even seen, with having it in our practice for over 6 years, that they're constantly evolving. The science is always there, it's always the same, but they're always trying to figure out how to be better. And I think that's one thing that makes CoolSculpting unique compared to other body contouring devices out there on the market. I don't think anything else compares, to be honest. We've tried other modalities in our practice, and we just noticed that patients weren't as satisfied as they are with CoolSculpting. And here at Renaissance, we are able to offer you the most latest and greatest technology that CoolSculpting has to offer with the CoolSculpting Elite. And we're really excited. So CoolSculpting is FDA cleared to treat numerous areas of the body, starting with the submental area or the chin. We can treat the arms, we can treat bra fat, we can treat the back, lower flank, love handle area. We can also treat the inner and outer thighs, as well as the knees. So an ideal candidate for CoolSculpting will be somebody who works out here and there or every day. They eat fairly healthy. They're somewhat within their ideal goal weight, but they just, no matter what they do, they still can't seem to get rid of these stubborn areas of fat. And no matter how much they work out or, you know, how many pounds they can drop on the scale, they still have these stubborn areas that they know are going to always bother them. And that's where CoolSculpting can come into play. So what we have found that works best with our practice is our patients doing at least 2 sessions of CoolSculpting. So that meaning they come in for their first session and, they may do multiple areas that same day. However, about 6 weeks or so later, they'll come back in and do their next session. And usually that's what most people find really gives them that wow factor where they're really happy with their results. But, every now and again, someone may want a third treatment or even to treat another area. So we've obviously established that CoolSculpting is non-surgical and no downtime. So with that being said, you can get the treatment done, you can leave here and do whatever you wish. However, there's going to be some little minor side effects to keep in mind when getting your treatment done. The most common ones would be swelling in the area that we treated or even numbness. And that can typically last anywhere from a couple days to sometimes a few weeks. It really depends on what area we treated, how many areas, and how many applicators we applied to that area. The other side effects that can happen are bruising. So if you're someone who typically bruises no matter what, you may have a little bruise here or there. So with that being said, I usually tell people if you have a big event coming up or you plan to be at the beach in a week or two, just keep that in mind when booking your appointment and scheduling your treatment. So CoolTone is the latest innovative technology to tighten, tone, and strengthen your muscles. It's a great way to target the muscles that you can't always reach when you're exercising in the gym. It's FDA cleared to treat your abdomen, your thighs, and also the buttock region. And we brought it into our practice in addition to CoolSculpting to really help kind of enhance your CoolSculpting results. So say, you get CoolSculpting to your abdomen, you get rid of that like top layer of fluff, as we like to call it. After, you get rid of that, you can go in with the CoolTone and kind of tighten and tone your, your abdomen muscles and make it look really nice for the summer.
All right, so I know you said your lower abdomen bothered you, but in order to fully treat the whole area, I think that you would have better results if we treated both the upper and lower. So this is my treatment plan for you. Does everything look okay?
It does, yeah.
Okay. Thank you so much for spending your Thursday night with us.
And don't forget that the winner of the giveaway will be notified via email.
And also, we will be sending you a text, so if you are interested in scheduling a consult, reply back and we will give you a call to schedule that consult.
And please stick around, and me and Kelsey will be answering any questions you have that you put in the questions tab. Thanks, and have a good night. Bye.
Hello.
Hi, guys. Thanks for joining us on your Thursday night. Let's answer some questions.
All right. So we already have a few in here. How many areas can be treated in one
Session.
Yeah.
So, really, it depends on how long you want to hang out with us. So, I mean, we have one machine, but it has 2 applicators attached, so we can treat multiple areas within the same day. We can do like your arms at the same time. We can do the love handles at the same time. And then they're 35 minutes, and then we can take it off and do another area. So really we can do however many areas you're wanting to treat. It just depends on how much time you have.
And it's really nice because we have the 2 arms on the one machine, so it kind of cuts your time in half. So that's awesome.
Yeah.
Is there any downtime, or can I return to work after my appointment?
So there's no downtime as far as, I mean, you can leave here and you can go back to work. You may just feel like you did kind of, depending on the area you treated, like you did a workout. You may feel slightly swollen, possibly some numbness in that area. It still may feel a little cold as the tissue's warming back up, but you could do this over a lunch break and go back to work if you wanted to.
And this is all certainly true for the CoolSculpting, correct?
Yes.
Mm-hmm.
Not the CoolTone, which is slightly different.
Yeah.
Is there an age that this is targeted for? CoolSculpting works on fat. What about skin? So this is kind of 2 questions. Is there a certain age that this is targeted for?
So, I mean, again, I've been doing this for a while now, and I feel like I've seen really all ages.
Yeah.
So I wouldn't say there's a certain age. However, the other question was CoolSculpting, does it works on fat, but what about skin? And that's a great question. And I would say that's definitely patient to patient based. So we kind of can, talk more about that when we see you in person at your consultation. But, CoolSculpting is targeted to, again, get rid of the fat cells and shrink that down. But it kind of depends on where you're at with this, how the skin is starting off. But I do feel like you get, a slight
And I think both of those sort of go together. So
Yeah.
if you have a young patient who has very stretchy, elastic skin, then as you take the fat away, that skin is going to tighten up without any difficulty. If you have an older patient that already has a little bit of stretch to their skin, well, then you have to understand that that's probably not going to tighten up nearly as well as a young person. Certain areas of the body are a little bit more, I guess they're easier to tighten up. If we do love handles, lower back, those sorts of areas tighten up much better than some areas of the abdomen, particularly after pregnancy.
Yeah.
All right. How soon before I can see results? That's a really good question.
Yeah, so I kind of like we explained in the video, so we typically do everything in 2 sessions. So you come in, you do your first session, about 6 weeks later or so, you do your next. And then we usually say give it about 3 to 3.5 months after that second session to see that final result. But it doesn't mean you won't see any kind of change before that.
All right. This person asks, how large of an area on the back is treated at a time?
So how large of an area on the back is treated at a time? So, I mean, I don't know exactly what.
It's very, what we kind of say, cookie cutter. So it will depend person to person, I would say. There's many different sized applicators. So depending on how big or small the area might be will depend on probably how long you'll be here and how much we can cover per applicator.
And to a certain degree, it just depends upon the patient. Some people are taller, some people are shorter, everyone's a little bit different.
Yes. All right. This person asked, what is the average price to do the abdominal area? And that's also very person to person based. I'd say we'd probably start at a minimum 2,400, and then everyone's different. So you may have to do more on someone and not as much on the other.
But we can definitely give you more of a custom price when you come in for your consultation.
Mm-hmm. Is the bra area just on the back, or does it also cover the side under armpits?
So again, kind of going back to what Kelsey said a couple questions ago, with CoolSculpting, there's different size applicators. So it really just depends on, where that fullness starts and then kind of where it tapers off to. And then, we kind of guide with those applicators on, where to put them. So it really just depends. And we could definitely figure that out when you come in for your consultation.
How do you choose the right applicator?
So, I mean, so they're kind of depends. There's flat ones, there's curved ones. So we kind of see where does it, you want to make sure that it fits and it has a good suction and that there's no rocking on them. And so that's kind of where we decide what size fits best, what if it's flat, is it curved, things like that.
And in your consultation, we definitely feel around for a good pinch of the fat in the area, and we kind of, like Kirsten was saying, see where it tapers off, so where it begins and where it ends, and that kind of gives us a good idea of how large the applicator that we may use in that area will be. How does it work for inner and outer thighs?
So that they're the inner thighs, it's a suction. It's about 35 minutes. And the outer thighs is actually a completely different type of applicator. If you think of your outer thighs, it's not as much pinchable. So it's actually a flat surface that cools, and it's 75 minutes.
Mm-hmm. It's more of like a flatter applicator and with no suction, like she said.
Yeah.
Someone says, I hear that the skin sags afterwards. Is this true? I think everyone's different, like Dr. Mills was saying earlier. Someone who's, younger, their skin may be able to retract a lot easier. They have a better bounce back, if you will. And then someone who's older or may have had children, they may have more skin laxity to begin with. So we always disclose that in our consultations. We let people know, it's a possible chance that, laxity may occur, but sometimes people are lucky and they have, good skin quality and they are able to, tighten up a little bit. So everyone's different, but it is just one of those things that may or may not happen for each patient.
But it's certainly one of those things where we try and give you an idea beforehand. So I don't expect that we would offer CoolSculpting to a patient and know that there's going to be skin laxity without knowing that ahead of time, at least to a certain degree. We want to make sure that you have the best result.
Mm-hmm. This person says, I was told my tricep area was not a candidate. I'm guessing it was because it was more skin than fat since I do work out a lot. Can you do that with the tightening treatment since you did not have that at the time?
So
probably CoolTone.
I believe you're probably talking about CoolTone. And unfortunately at this time, we cannot treat the arms with CoolTone. It's only FDA approved to treat the abdomen, the buttock, and the thighs. I think it's got a lot of power and it's just too close to the heart.
Mm-hmm.
And we certainly know that they're working on other applicators, but as of this point in time, they don't have ones that treat the arms.
Yeah. Hopefully soon.
If doing the chin, is there any discoloring?
So when you're doing the treatment, you'll have, as far as it gets very cold, so it's, it's kind of a red color. But as the tissue and everything's in your blood flow is kind of rushing back to that area, when the treatment's over, it should go back to normal. But you do want to be careful. Like I always tell people when they get CoolSculpting, you're getting that tissue to such a certain degree of cold. It's not like you'd want to leave here and, go in a tanning bed or anything, because you possibly could have that, the possibility of some discoloration if you were to do something like that.
And it's not frequent, but you can also get some bruising in the area.
Yeah.
Okay. Could you explain the CoolTone treatment, what it feels like, how long is the treatment, and what are possible results?
So I think we've all had it here.
Yeah.
I would say, as far as what does it feel like, I've done like your abdomen I've treated, and I feel it's kind of like doing a crunch, and you're kind of, you're causing some muscle contraction. So you're kind of tensing up and then it releases and tenses up and then releases. And the abdomen's it's a 30-minute session, as well as the buttock area. The thighs are 20 minutes.
Mm-hmm.
And you typically have to do 2 sessions a week. And those treatments are about at least 2 days. You want to wait at least 2 days in between those sessions. And then we usually say about 6 to 8 sessions. And then you'll always need maintenance to maintain those areas. anything else you'd want to add?
I think it's a pretty significant contraction, so it's going to feel like you are doing a really hard crunch.
Yeah.
With that said, I'm a guy, and I'll be the first one to admit that we're babies.
Yeah.
And so I really felt it, whereas these ladies here, I think they did just fine.
Yeah, and I mean, it's patient to patient based. Some areas, I think, like I've actually done the thighs, and I don't feel like it bothered me really at all, but it just depends.
The other thing to keep in mind is when you first start with the CoolTone, we're going to start at a relatively low setting, and then you can increase as you go through the session, and you can increase as you go from session to session. And as you get used to it, you'll find that you can tolerate much more, and you'll get a better, faster result.
Yeah. All right. So is the price for the thighs for both legs? So in your consultation, we will give you a quote for both of the legs, also depending on how everything is displayed, you know, how many treatments and cycles you'll need, depending on outer or inner. So we definitely recommend 2 treatments for every patient, but that's something we can talk about price-wise at your consultation. Is there a chance that it could be lumpy after the treatment? Would you say like lumpy, like after CoolSculpting? I wouldn't.
I mean, it shouldn't be.
Yeah.
It should, as long as the person that's doing your CoolSculpting does the right amount of, places the applicators in the correct spot, then you should have no issues with that at all.
And typically after like the 2-minute massage, we're really trying to get that blood flow to come back in the area. It warms up. So really you shouldn't, if anything, you might leave a little bit swollen with, bruising, but really no lumpiness as far as we've ever seen. How often do you recommend maintenance treatments? And I'm assuming for CoolTone.
So usually, we're usually one maintenance treatment every 4 to 6 weeks. I want to say, when you're doing those areas, because you are getting stronger, you should actually be able to feel when you kind of need a maintenance because you're not feeling as strong. Maybe your planks aren't as long as they were when you first, finished your CoolTone session, and you can kind of guide off that too when it's time to come in for that maintenance.
Yeah. I feel like a lot of the patients, we do feel a lot stronger when they're going through, their first series, and then after maintenance or for maintenance, they're like, yeah, I feel like I need to come in and get more.
And I will say that everybody, I think, is probably different. I mean, just like whenever you work out, you see those individuals that gain muscle very quickly and easily. You have others that have a hard time. And so those that have a hard time may need to come in more frequently, or potentially have additional sessions. But for the most part, once you get through those 8 sessions, then you should be good.
Or if you have a vacation coming up, you can always pop in and do one before that as well. So
Absolutely.
It really is, it's kind of up to you as well.
All right.
Any other questions?
Don't have any coming in currently, but something I like to touch on, just so everyone and all of our viewers know, at Renaissance, we always have the doctor come into your consult. So that way, you have a physician to always, rely on. And that way our treatment plan is discussed and they agree. And if you have any questions for them as well, I think that's what kind of makes us special is we do have them here
There's always one of us available.
Yeah.
In the building. And so if there are issues or concerns, not that I think that I've ever been called for one.
Yeah, but you're always here.
CoolTone or CoolSculpting or anything like that. But we're always there and available.
Yes.
And then we just got another question. It says, is there always 6 to 8 sessions? And I assume they're talking about CoolTone. And yes, 6 to 8 is typically the sweet spot, and some people may need more, or those 6 sessions may be good. It just depends.
Can you still work out after CoolSculpting or CoolTone?
You can. You can still work out.
especially with CoolTone. CoolSculpting, you're probably, again, it depends on what areas you treated, how many areas, how many paddles we put on the, the area that was treated. But I mean, if you're okay with feeling a little swollen or numb or a sore, you're more than welcome to continue to work out for sure.
There's a small possibility it may increase your bruising just a little bit, but I don't think that's typical.
Yeah.
And she said, does the price include all sessions? Yes. When we quote everyone, we include, definitely the 2 sessions we recommend. All of that will be, priced out in your quote.
All right. And then let's go over. So there are some giveaways for tonight. So we are going to be, one lucky attendee is going to win a free transformation package. So to enter and receive the 1 entry, you do have to come in for a consult within 30 days after tonight's event. And then if you want to receive 2 or more entries, you would need to purchase a package, a minimum package to receive those. And then you also can enjoy 10 free CoolTone sessions with the purchase of a CoolSculpting package. And then we're also giving away a Skin Medica Fermentone, which is really nice. It's a really nice lotion to help after your treatments. Perfect.
Any more questions?
Let's double check if anyone else sent any more in. I think that is it.
I think that is all, yeah.
Perfect.
Thank you all for attending.
Well, thank you guys for your time. Thanks for spending your Thursday evening with us. And be sure to, I think you'll click a link to set up a consult, and we'll be reaching out to you guys tomorrow to do so.
Yeah. So don't forget to hit the link if you want to schedule a consult with us, and I think our front desk girls will give you a call tomorrow morning. All right.
Bye, guys.
Bye.